Welcome back, Dr. Idowu. Thank you so much for the information you gave last week. It's really, really beneficial. For those of you that have not been watching the videos, watch it. It's really helpful. And if you have anyone that you think will benefit from it, please share the video. She's doing this out of the kindness of her heart, and it's just because she's passionate about people living healthy lives. So, Dr. Idowu, what do you have to talk to us today?
I'll be talking to men age 40 and above concerning health maintenance. It is very, very important that you go to your doctor, especially men. Men don't like going to the physician. So please and please, very, very important. In this age group, there's high risk for blood pressure, there's high risk for diabetes, there's high risk for stroke, heart attack. The more reason why you need to go to your doctor. And when you get to your doctor, they will check your blood pressure, they will check your weight. Very important to make sure that you are maintaining, you are improving these things. Also, when you get to your doctor, they will do blood counts, complete metabolic panel, complete blood count, thyroid function test, lipid panel, hemoglobin A1C. High cholesterol in this age group also is a risk for stroke, is a risk for heart attack. So the more reason why all these things needs to be checked so that you are aware of them. You can do what is needed to correct them, to improve them, and to maintain them. Very important. For men in this age group, when they have blood pressures, they prescribe medication for them to control their blood pressure, but most men will not take it because it affects their sexual function. But what I always tell them is that it is very important you take your medication to control your blood pressure, because you don't want to have stroke, you don't want to have heart attack. When you do, you can't even do anything at that time. But thank God there's medication that can improve your sexual function if you have them using these medications. Most blood pressure medications have that side effect of sexual dysfunction. There's nothing we can do about that. Even the disease itself has a side effect of sexual dysfunction. So please, 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 take your medication, talk to your doctor about the problem you're having with them so that they can give you the best one that is least risk for affecting your sexual function, and then they can give you medication to help as well. Very important. Please do not stop taking your medication because of this, because when you have a stroke, you have heart attack, it's over anyway. So the other things that we do at this age group is make sure that you do your colonoscopy as well. Very important. Colon cancer is common in men as well, so knowing that taking care of the polyps in your colon before they turn to colon cancer, very important. So please do your colonoscopy. If you have a family history of colon cancer, you may need to do colonoscopy earlier than age 50. So important that you know your family history as well. Also, men in this age group, prostate disease is common. Sometimes the way is that you are peeing all the time. For men, they shouldn't get up at night to pee, but sometimes when you start getting up at night to pee, then you start thinking what could be wrong with you. Also, when your urine stream is not going the way it should, or when you finish urinating, there's terminal dribbling. All this are symptoms of prostate disease. You need to go to your doctor so they can check it out. Prostate disease can be benign, and some of them can be because of cancer. So taking care of it, very important. Prostate cancer is common in Black people, Black men. So you need to check. It can happen even at ages earlier than 50. In some people, they have prostate disease, and so you need to really check and make sure that things are going well in that area. Also, you also need to have your eyes checked as well. You need to have to be screened for glaucoma in this age group. Like I said, glaucoma, can cause you your vision, and people will not know it's a silent cause for blindness. So go to your eye doctor, have your eyes checked, let them screen you, make sure that you don't have glaucoma. Very important. Also, it is important that you go to your dentist as well. Make sure that your oral health is very good, that you're taking care of your teeth. You don't want to lose your teeth, and use dentures as well. So all these things are very important that we do especially for men, please go to the doctors. Men feel that they are invincible, nothing can happen to them. Please go to the doctor, check out, make sure that you're doing the right thing. You don't want to leave your family at age that is not appropriate because of a heart attack, because of stroke and things like that. So please go to your doctor, check it out, and things will be okay.
Thank you so much, Dr. Idowu. For those of you that have been watching, you would see that she's really sharing things that, you have to advocate for yourselves. When you go to your doctor, make sure your doctors are checking this. Don't let them just check you for malaria and tell you that you have malaria or you have typhoid. Check this every year. It's important. And the women, please force your husbands, if you're married, please force your husband to go to the doctor. Men don't want to go to the doctor. Every year, I make sure that my husband does his own physical. It's not even open for any discussion. So please be your husband's keeper, be your brother's keepers. For those that are not married, the women, just encourage them to go. God bless you and see you next time. Bye.